Good afternoon, I am Dr. Siew Tuck Wah from Radium Medical Aesthetics. Today I'm here to talk about facial fat grafting versus dermal fillers. What is facial fat grafting? Facial fat grafting, also known as lipofilling, involves a mini liposuction procedure to extract some fat from anywhere on the body such as the abdomen or inner thighs, purifying the fat, then injecting it back into the face as a filler to treat volume loss. Patients often ask me what the difference is between facial fat grafting and dermal filler injections, and they always ask me which is better. The truth is, there is no one procedure which is better than the other. It all depends on the skin condition and what we're trying to treat. Fat grafting is a procedure which is better for treating large volume loss. It is excellent if you want to treat areas like the temples, the cheeks, when you have lost, say, a lot of weight and require to put in back a lot of volume to make you look youthful again. The procedure is also permanent. So after you put the fat in, some of the fat will die off, perhaps about 60 to 80% will survive depending on a variety of factors. And once the fat survives, it is a permanent result and you generally do not have to repeat the procedure again. Fillers, on the other hand, usually need to be repeated on a regular basis, sometimes 1 year, sometimes 2 to 3 years, depending on which filler is used. However, there are some advantages of dermal filler injections over fat grafting. Firstly, fillers are a less invasive procedure. You can come into a clinic and have the procedure done and just go off and go about your usual business. Sometimes, if you get some bruising or swelling, there can be up to a week of downtime. But in general, for fat grafting, the downtime period is more because it is considered a bigger procedure. You first have to harvest fat from areas such as your abdomen and then inject it back into the face. And because there are often larger areas of correction and you have two sites where there is some procedure done to it, there is more downtime. It can take up to 2 weeks to recover fully from a fat grafting procedure. Fillers are also something you want to use if you are not ready to undergo a full face treatment and you just want to treat one area such as the nasolabial lines or the under eye area. Because in fillers you can just use small amounts, 1 ml, 2 ml, but in fat, once you have sucked up the fat, you want to inject the whole face. You do not want to undergo a mini liposuction procedure just to inject one area. It's just not worth it, both financially and the pain that you go through. Fillers behave differently from fat. Fillers are a gel that have different physical characteristics as we have described in the previous video. Hence, you can use softer fillers for areas like the eye, and you can use something which is much firmer to sculpt the chin or the nose. Whereas for fat, it is different. It is a soft substance that spreads. So fat is more suitable if you want to volumize large areas, for example, the submalar cheek area. So in this instance, if say you want to treat an area and give it a lot of firm projections such as the chin, then filler will be a better product to use rather than fat because you get a nicer result and a more sculpted look. Cost is another issue you want to think about when you want to choose between the two procedures. If you are going to fill larger areas, say more than 6 mils to 10 mils, it may make more sense to do fat grafting rather than fillers because simply put, it is more economical to do so. One other important point to note is that fat grafting is an irreversible procedure. Once you inject the fat in, those fat that is retained will stay there. There is no way to take it out. This is in contrast to filler injections, where after you inject, if say something goes wrong, you can reverse the process by injecting an enzyme called hyaluronidase. So if you want to do a fat grafting procedure, it is very important that you find a doctor who is very experienced in the procedure. In conclusion, there is a role for both facial fat grafting and dermal fillers in treating volume loss and for anti-aging. The important thing is to speak to a doctor who is experienced in the procedures to give you a balanced view of which is more suitable for you. In general, facial fat grafting may be a procedure which is more suitable for you if you are someone with severe volume loss and who needs large volumes of replacement. On the other hand, if you want a less invasive procedure and you want to treat just one area, for example the under eyes, then you may want to consider dermal fillers instead. Speak to your doctor to find out more so that you can know everything about the procedures and make an informed decision on which is the better procedure for you.